Welcome to Dr. Grace Medical Show. I'm very glad you're watching today. Today let's talk about urinary tract infection. What is urinary tract infection? This is an infection in the urinary system. That is, infection in the part where you make the urine down to where the urine is let out. That means it could be infection in the kidney, infection in the ureter, infection in the bladder, which is your urine bag, and infection in the urethra, which is the small part that allows your urine to move out of your body. Why are we talking about this infection today? It has been shown that more than 3 million people are infected with urinary tract infection in the United States. The urinary tract infection is very common mostly among women of any age, and it is very common worldwide. It is an infection that many people do not have understanding of why they do come down with the infection and what they can do if at all they have the infection. So we are going to lay emphasis more about it. Why is it so common among women? One, because of the female short urethra, that is the small part that leads your urine from the urine bag to where you let out the urine. It's a very small part, and because it is very short, you can easily get infected over there. Another reason is the close proximity of the urethra to the anus where you pass your poo. And this is the reason why infection can come from either way from this area into your urethra. And what else are we talking about? Do you know that the urine you produce, the urine you make every time, the normal urine does not have bacteria in it. It does not have bacteria. It becomes infected when microorganisms get clinged to the urethra and begin to multiply. And once they multiply, they can spread from the urethra to the bladder, and from the bladder back up into the kidney. And it is very important for you to know that once you can help yourself to prevent microorganisms from clinging to the urethra opening, you can actually help yourself to stay healthy. And that is why I'm glad you are watching today. I'm going to teach you and explain to you what the measures you can do. What are the possible symptoms of urinary tract infection? Burning urination. When you go to pee, you feel the burning sensation over there. What other symptoms do you feel? You feel the frequent need to urinate. You just want to urinate. You want to pass the urine. And when you pass the urine, you pass it in small amount of urine. And sometimes some women complain of lower abdominal pain. They begin to have pain in their lower belly. Down below their belly button, they start feeling the pain. What other symptoms you can have? You could have temperature. And when you start having temperature, as a doctor, we start thinking if your infection has spread up into your kidney. You can also have back pain. Back pain, I mean not just at your back spine, it could be by the side of your body. Low back pain on the side, which is the lumbar side as we call it. And you could have nausea or vomiting. And sometimes your urine color may change to cloudy or to milky, and sometimes it could be bloody. And these are the symptoms of urinary tract infections. When urinary tract infections occur, it happens most of the time in your bladder or in your urethra, and that is why we need to take preventive measures. What are the things that can trigger this infection? One of them is anything that can cause your urine flow to be reduced. We cause we stage up infection for you. One of the things that can block the flow or that can reduce the flow of your urine to the outlet is one, kidney stone. If there is a kidney stone, if there is a prostate enlargement. What do I mean by prostate enlargement? When the prostate, the little small gland in a male, is swollen, it can press the part where the urethra is supposed to flow out and block the flow of urine. Another thing is in pregnant women, especially it has been shown that 2 to 4% of pregnant women come down with urinary tract infection. And when they have it, they don't give symptoms. Most pregnant women that have urinary tract infections, they may not show symptoms. And the reason why they have this infection too is because of, one, their hormone. There's an hormone called progesterone. This hormone helps to relax the smooth muscles in the body. Now, this smooth muscle affects the urethra as well, and that slows the flow of urine, and this can cause infection. Another thing is the shift of the urethra, of the part of the urinary system, because of the load of the baby. The size of the uterus, the womb, can push it to the other side, and this can stage of infection. What other things? When you are used to holding up your urine, you know you're supposed to go and let out the urine, but you do not want to do so because either you do not have time or you don't think you should do so. It is a bad habit. Try to stop the habit of keeping your urine for too long because it can stage up infection. Another thing is the use of catheter. When someone is sick or someone is on catheter for too long, it can allow infection to stage in. Are there other things? Yes. People who use diaphragm as a method of birth control, it can also allow infection to stage in. Are there other things like people whose immune system has been compromised, has been depressed, like diabetic patients? They are very prone to urinary tract infection. So how do I know that I have urinary tract infection? Once you see all these symptoms, go to the doctor. The doctor will text you, do some investigations for you. First, we take your history. From your history and from the investigations done, we will be able to give you appropriate medications. The medications usually we give antibiotics, but it depends on what is actually causing it, the microorganism that is found in your urine, and that depends on the medications that we will give to you. But the most important thing is for you to prevent yourself from having urinary tract infection. So how do I do so? One is to develop a good toilet hygiene. What do I mean? I mean, when you go to toilet to pee, to pass your urine, you should wash yourself from front to back, and you should wipe yourself with wet paper towel anytime you go to pee. Another thing is to avoid tight clothing. When you wear tight clothing down there, it can cause heat to generate, and this can cause the part of your skin to discolorate, and before you know it, they allow infections to spread up from that area of your perineum into your urethra. What other things can you do? Which is what we all know: increase your fluid intake. Some of us don't take water as we're supposed to. We prefer to take soft drinks. We prefer to take other manner of fluid, but water is very good for your kidney. Water is very good for your urinary system. So I invite you today to please encourage yourself to always take water, especially when you go to pee and you see your urine color is very thick and strong. You should know that it's time for you to increase your fluid intake. Are there other things you can do? Yes. Whenever you have sex or sexual activity, have yourself to develop an attitude to clean up yourself or to empty your bladder, and this helps to prevent your body from getting bacteria or infection into your urinary tract. I hope you understand today what we have discussed. Children, like I said, they are very prone to urinary tract infection too. Urinary tract infection is very common to all ages, especially in children less than 1 year. They can also have it. And why do they have it? Because sometimes their urinary system is not well formed during birth, or before birth, I mean. And sometimes the bodies are not circumcised. It gives them room for infection for microorganisms to stay in. But all the same, they can all be prevented. So if you have any question or any comments, don't forget to link down below. Check me on my blog, and I'll be able to answer your questions. We have doctors in the house that will also help you in answering your questions. Thank you and have a good day. Bye.